So you started your career in Canada and you now teach health policy at Johns Hopkins. Can you tell me a little bit about yourself and how you came to teach health policy in the US?
Well, that would be a very long story, I'm afraid. But let's say that to decide to change country and to change job and to change city, there is always many reasons, and the most important for me at the time was when I was offered the job by Hopkins was that this impression that so many things were happening in the U.S. at this moment in the health sector. And, you know, I have written a piece a year ago saying that we're on the verge of a new revolution in healthcare, and I didn't want to be on the line cheering. I wanted to be in the middle of the field, and I thought Hopkins was a perfect place to be, and so I have accepted their offer.
So, I mean, as you pointed out, there's many changes happening in the U.S. health sector. I'm curious, though, what are some of the challenges facing the Canadian health system, and are they similar or different in many ways from the U.S.?
You know, they're not that different. In fact, the U.S. and the Canadian systems are on many aspects very much alike. You probably know that we train our doctors exactly the same. And so it means that basically, I remember the word of a journalist, I think from the Washington Post, saying that basically Canadian medicine is American medicine with a delay. And so the two systems so much look alike from the point of view of the care that is provided, the way it is provided, the place where it is provided. But on the other hand, as you know well, the two systems differ by the way, the only fact that we have in Canada a single payer system and that you don't have it in the US, and you have this very complex system of payment for care.
And in terms of some of the health reform debates that occur in Canada versus the U.S., you know, many people talk about the U.S. as being sort of exceptional since we are the only country that doesn't have a universal health coverage system. But how different are the kinds of policy issues that are discussed in the U.S. versus Canada?
You know, my sense of there is an American exception in healthcare, and it is not the payer system. The real American exception is managed care. It's the fact that most Americans get their care to some form of managed care system, and that is completely unique in the world. And it creates challenges and opportunities that do not exist in other countries, and certainly not in Canada. And to go back to the core of your question, I think that in both countries we are struggling now to adapt our policies to the changes in healthcare and this new revolution I was talking about, but also to adapt our systems to the values of our nations, which have evolved. In Canada, our system has been built, as you know, during the 1950s and 1960s. At the time, Canada was, for the most part, a country of working class and agricultural workers. And it reflects the values of those classes very much so, the solidarity, the preoccupation for equity, which are still very important for people. But Canada is now a middle-class nation. And I think the system doesn't reflect the values of this particular middle class, that is, you know, asking for more choice, for instance. And I think the system will have to evolve in that direction at some point. And I think the same exists in the U.S., the same need to adapt better the health policy to the values of the nation as they are now.
So many, you know, progressive health reform advocates in the U.S. Really look to Canada or Canadian-style single payer as a model to emulate. What do you think are the prospects in the U.S. of having a single-payer healthcare system? Will that ever happen?
It will certainly happen in some places. You know that Vermont is pursuing this idea of a U.S.-made single-payer system, and I think this is for the better. But will you ever have a system that, you know, at the national level will look like Canada or the U.K. or Germany? I'm not sure, and I don't know why you would be pursuing this at this moment. There is other ways to achieve probably the same results in terms of getting people better access, controlling cost, and so on and so forth. I don't think this is the major problem that the U.S. is facing at this moment, and I won't personally prescribe that route.
Do you think there are any policy lessons that Canada can learn from the U.S. and the kinds of reforms that the U.S. is undertaking under the Affordable Care Act, for instance?
Oh, many. I think, again, this is probably one of the motivations where when I decided to come to the U.S. in the first place, is that, for instance, the number of experiments you're conducting now. The U.S. is at this moment a gigantic laboratory in terms of healthcare transformation. So you're experimenting with integrated care, which is one of the growl of the Canadian health system. How could we better integrate our system? You're innovating in clinical governance. You're innovating in payment system. You're innovating in the way you integrate information systems into the provision of healthcare. We don't know how to do this. And I'm pretty sure that many of those innovations, when they will have been tested, evaluated, will start to diffuse to Canada.
Some of the challenges within the Canadian health system, at least that Americans tend to point to, have to do largely with long waiting times. And in terms of quality of care, Canada doesn't always score that highly on international indicators. I'm wondering, do you think that characterization of the Canadian health system, as simplistic as it probably may seem to be, is that in any way accurate? And what do you think are the major causes, particularly in terms of the wait times and accusations of rationing?
Yeah, very often I said, the miracle in Canada is that we have those great health outcomes despite the poor performance of the system overall. It's probably unjust because, in fact, Canada's faring pretty well in terms of equity and access, and it means that at least in terms of the access to primary care, it's probably still the better performing system in the world. The problem comes after in terms of access to specialized care and integration, as I mentioned before. But the real question for the Canadian system at this moment is not so much cost, it's not so much access, it is, as I mentioned, integration and the capacity to actually transport what we have been able to do in primary care to the other levels of care in the system. Another point I could make here is that one of the reasons we have those healthcare outcomes is probably not because of the money we spend in healthcare, but because of the money we spend on social policy at large. And I think the same kind of reasoning should apply to the U.S. The reason you have relatively poor outcomes despite the incredible high level of expenditure is probably because you don't invest enough in social policy. And it's probably the way of the future.
I think that's a very good point, and that's something broader across the U.S. system in terms of being a sort of very liberal welfare state in the sense of not of being sort of stingy in terms of the welfare state. But I'm wondering, in terms of the Affordable Care Act, which has dramatically expanded access, but not necessarily changed too much in the underlying way that health insurance, at least, is provided, still primarily through employers, for instance. Do you see the U.S. under the Affordable Care Act as sort of joining the club of other countries that have universal health coverage, or do you see that there still is a ways to go in that regard? I
think the jury is still out. We don't know yet. When I look at what the ACA is doing, for what I could understand, because as everyone else, when I read this massive act and piece of legislation, it's still very difficult to know what will happen in the end. But when you look at the ACA at this moment, you still don't know if this is very bold or not, because in a way it doesn't change the policy field that much. As you just said, it doesn't change basically how people are insured. It increased the number of people that are covered, but it doesn't change the way they are covered. It doesn't really change the way care is provided. It doesn't change deeply who is delivering care. So is it a revolution, or is just an act waiting for the next step? And we don't know at this stage. But on the other hand, I have to admit, basically, if we go to the end of this phase of the reform, you will have insured a population the size of Canada. This is like creating one Canada of insured people within the United States. It's unbelievable when you think about it in terms of the number of people covered and the needs and the services that will have to be provided.
Well, thank you very much for joining us today. That was all the questions that I have for you.
It was a pleasure. Thank you.
Thank you.